Welcome to 101. I'm Greg Bassett, your host from the Salisbury Independent newspaper. My favorite guest of the year is here. He comes every summer and every winter, if we can get him in here. He's Roger Follebout from Peninsula Regional Medical Center. Welcome, sir.
Hello, Mr. Bassett. I should be your favorite guest, period.
Well, last summer I was a little bit depressed, and I had you in, and we just yucked it up for half an hour.
We had a great time.
But now there's like serious stuff going on, so we have to be serious about things.
Unfortunately.
So we are in the middle of a pandemic. I had your boss in a few months ago, Steve Leonard, when this first hit, what the preparations are. But now we're in it. So what is going on at our regional hospital in terms of the pandemic?
It's pretty crazy. You know, it's like you put your head down in February and went to work and lifted your head back up and it's July.
Yeah.
It went by seemingly very quickly. It has been the busiest I have been in 22 years at that hospital. No question about it. To give you the quick update on today as we tape the show on, what is it, the 21st of July, we have between Peninsula Regional and Nanticoke in the health system, I believe, 11 COVID positive patients under our care.
Now, at the peak, I remember about 70, but usually there were about 44 or 45.
Correct. At the peak, which is around the 27th of April.
Right.
72 or so in the hospital here, another 40 or so up at Nanticoke. So 115, 120 patients at the peak, 11 today, and our numbers have been really consistent. I know you're hearing a lot about the uptick of positive cases and numbers rising in hospitals around the country and even somewhat over on the Western Shore, but for the most part, for us and for Nanticoke, steady as she goes, which is really good.
Now, as just a person just riding around, being down Ocean City and stuff, I'm like in a panic that there's going to be a surge any minute given what's going on down south. Is that the sense in your building as well?
I don't know that it's the sense. I don't think there's the urgency to it, but it certainly has caught our attention.
Right.
We, like everyone else out there, can't stress enough the importance of putting your mask on when you can't socially distance outside and be away from others. If you can't have that 6 feet of separation, please keep your mask on. By all means, when you're inside, put your mask on. When you're shopping, have your mask on. When you're around people. And what people seem to forget too, and this is really important, that mask that I'm wearing is protecting you more than it's protecting me. So do the right thing. Put the mask on and help stop the spread and the infection of others. It's what we all need to do. It's one of the essential things. Can't stress enough again. Wash your hands, sanitize your hands, stay vigilant about that. And now is not the time to stop. And really, if you can avoid the crowded spaces and you don't need to go into them, then don't. Obviously, we have to grocery shop. We all have to go shopping. We have to do things like that. But do I give a second thought now about going to the boardwalk on the weekend? Yeah, I do.
Yeah.
I'd much rather be sitting on the beach somewhere, separated from some folks, than to be walking with 30,000 or 100,000 of my other friends on the boardwalk at any given time. Just be smart, be cautious, and be proactive.
Yeah, and I sort of see wearing a mask as just being polite. I mean, it's not going to protect me, but I'm not going to be giving it to someone. Probably.
It is the right thing to do.
Yeah.
And the last thing you want to do is get someone else sick, who then gets somebody else sick and somebody else. And this is where it snowballs. And that's how it snowballs. And that's how it became such a prevalent issue for us, from February to really June, March to June in that time frame. And it's the reason I believe, and I don't have any scientific data to back this up, but it's the reason I believe that we have flattened the curve the way we have is because people are masking up and they're taking precautions and taking care of themselves and others.
On our website right now today and in our paper this week, we've got a profile, a feature with Debbie Donaway from Salisbury Urban Ministries. She was a COVID victim. She was in your hospital for 22 days. She had a relapse. She really went through the whole thing, and she's still in the process of recovering. And her comments about how she was treated at the hospital are really very positive. The idea that you all really knew what you were doing. And I think it's just a great testament. I've been waiting for some kind of story like this to put in the paper so people can, if they see someone they know, because they might be like dubious about it, they see someone they know who goes through it and they're like, wait, this thing is real.
It is the real deal. I mean, you'll recall when this started, when we first started hearing about then coronavirus back in February, March, January, February maybe, people were saying, no big deal, right? It's just like the common flu. You'll get over it, you'll be sick for a few days. This turned out to be a wicked, nasty virus, and it doesn't care who it attacks. I mean, we've seen people of all ages getting sick. I also want to say thanks for the kind words about the organization and the team too, because the nurses, the physicians, everybody, the environmental teams, the food and nutrition teams, everyone who has cared for patients during COVID has really poured their heart and soul into this. We have to live with it too. I mean, it's our world as well. It's not just taking care of patients, it's taking care of ourselves, and it's what we experience the same time that everybody else is experiencing it. We have been ahead of the curve as it relates to the state of Maryland, which was good. We were putting our staff in masks before it was required that they do that. We were asking our patients to wear masks, and those visitors that we were allowing in, the support persons, to be in masks before it was required. We established tents outside the emergency department so that we could meet patients coming in and sequester the COVID concerned patients to a separate part of the emergency department so they didn't cohabitate with anybody else in the medical center. We established the portable hospital outside, the inflatable portable hospital outside the emergency department if that was needed. And probably two of the most incredible things we did is we took our conference center and converted a conference center into a 44-bed intensive care unit with all the medical gases and negative pressure that's required. Did that in 18 days.
Right.
Which is remarkable. That's a 2-year project anywhere else and any time else.
Created an ICU in like 2 weeks.
18 days to create an ICU. And then we took the Layfield Tower and made the entire Layfield Tower our COVID tower, took our conventional, if you will, healthcare patients out, put them in the old 77 building, the East and West Tower, and made 3 Layfield, 5 Layfield, and the entire tower our COVID tower. And the remarkable thing about that is that tower was built in the days of Ebola. Do you remember Ebola?
I do, yeah.
So when we built the tower, Ebola was hot, and we made the entire tower capable of being negative pressure.
Right.
So that really helped us out. So in the flip of a switch, we could convert an entire segment of our hospital to a COVID containment area, and that was remarkable. And it allowed us to continue to care for patients and to really segregate that population from the regular patient population. And from the start of this, the two never met. And we, restricted visitation very early in the process as well, and then closed visitation very early in the process. So, at one point we were putting staff in masks, and the state of Maryland came to us and said, stop, get your people out of masks who don't need to be in masks because they're in short supply. And then 2 days later turned around and said, put everybody back in masks again.
Right.
So, kudos to the organization. I've lived it. I was there. I was a part of it through the entire time. And we have really, really been ahead of the curve. And this community, this region, should be extremely proud of what those healthcare providers at our organization have done. Just a remarkable job.
Yeah, and it's funny how people's perceptions are. So I got this from a reader. When you first announced you're going to convert the conference room into an ICU unit, I was like, good. That's very, that's productive, proactive. Very impressed by that. Okay, they got a handle on this thing. So I felt really good. Had a reader call and go, I hear things are so bad over there. They're having to convert a conference room into an ICU unit.
Right.
Both true.
Right.
But it was preventative thing. It was you got taking a correct step. It wasn't a reaction. It was proactive.
Correct. Half full, half empty, right?
Right.
We knew, at least the data that was being driven at the time indicated that this was going to be a very critical care type virus that was going to make people extremely sick. And it did, but not to the degree that we expected. It became more of a medical issue for us. There were really sick people in our hospital, don't get me wrong.
Right.
But there were fewer people than we anticipated who required ventilator care. Am I happy that we ramped up and could have handled upwards of 120 people on ventilators if we needed to? Absolutely. Because had it gone the direction we thought it was going and we weren't prepared, it could have been catastrophic.
Right.
We were absolutely prepared. Thank goodness we never had more than a handful of people on ventilators. When I say a handful, no more than a dozen or maybe 20 people at any given time on ventilators. But we were ready. we were ready, and that's what we had to be. I mean, you know, we are the premier tertiary care medical center in this region. People are going to turn to us in situations like this. We have to be prepared and we have to be ready. What I do want to share too, and give my own team a little pat on the back, is we, during this entire COVID pandemic, became really the source of information that people turn to in social media and through the website. We were getting millions of hits every week on the website and through social media of people coming to us to find out what was going on. Our social media page was actually getting visited more frequently than all of the other hospitals in this region combined on a weekly basis, and on par and ahead of most weeks the University of Maryland and the Anne Arundel Medical Center over on the other side of the bridge. So we worked very, very hard to get the information out and to keep people updated. We were extremely transparent from the beginning too. I mean, I caught a lot of flack for putting a press release out about a portable morgue that we rolled in and put next to the hospital. But you had to know that we were ready.
Yeah, that was very jarring to see that. That was another one of those things, to see the portable morgue. Okay, this is going to get bad.
Correct. But again, wasn't necessary,
Yeah.
but another one of those precautionary measures you had to take. And I wanted the public to know that.
Yeah.
I mean, let's face it, this was, as we said, this was the real deal. And I wanted people to know that this hospital, their hospital, was 100% prepared, from doctors, nurses, patient care techs, lab techs, all the way through to portable tents outside, portable morgues outside if they were needed, and everything that comes along with being prepared to take care of our community.
Yeah. I was in one of the calls. Steve Leonard was on the call. I forget what it was, the health counselor or whatever. And I was listening, and as a reporter, I was waiting for him to try to spin something or not answer a question. And he addressed everything that was being asked on the call by everybody. It was just very transparent.
From very on in the process and continuing today, we post every Friday the number of COVID positive patients we have admitted and those that we have discharged. And it's wonderful to see the numbers, how they've come.
And when you had discharge, you guys used to play a song, or how does that work?
It was a snippet of "Here Comes the Sun."
Okay.
Every time that they discharged a patient, and it became kind of a signature song for us. And people absolutely loved hearing that song during the day because it meant another person was being discharged and going home and had gotten well and had gotten out of there. But we have always been an organization that wants to share with the community what we know and what we're doing. But we have been open and honest, and we've tried to bring everybody along for the ride with us so that they know exactly what we're experiencing and what's going on out there in their world too. They have a right to know. As I said, we're living it, they're living it, everybody's living this thing.
Just got a news release, came across my desk. You're closing the entrance to the cancer center. What's that about?
No.
Yes, I'm confused.
You are confused.
So explain it to me.
So we're closing the entrance to same-day surgery and labor and delivery.
Okay, that's around the other side.
Correct. That's Vine Street. Think like on a kitty corner from the Exxon station that sits there on the corner
Right
of
there, right there by where the
13 and
ambulances
Vine.
come in for the
Correct.
emergency room.
Correct. So that entrance is permanently closing to inbound public traffic. Staff will still be able to access that door and go in. Anyone will still be able to exit out of that door, and we'll be discharging patients out of that door too. But it's all part of our overall security hardening plan. We have, and I kid you not when I say, upwards of 30 different points of entry.
You've always had too many entrances
into
there.
the medical center.
People can come and go. I've always wondered about that.
Far too many. And if there has been a silver lining to COVID, it has really forced us to step up and take a look at closing down some of these entrances that are absolutely non-essential to what we're doing. Now, that's not to say that the same-day surgery and L&D entrance wasn't important, because it was. But not that far away, we can bring traffic in and visitors and patients in through the Hannah Outpatient Center.
Right.
Register everybody there, keep a better handle on it, safely move those people through to where we need them to be in the medical center.
Right.
And it just works out. It just works out. It's one of those major entrances that we didn't need any longer, and it was just smart.
Right.
Smart. Good business to close it up. And
Right now, it's another place where you got to position someone with a thermometer to check people that are coming in. It's
correct. So, and again, I don't know when we're going to get back to normal operations again. So this just makes sense. I mean, when you want to keep a better handle on who's in your building, and you want to make sure that people are safely coming in and out and traversing your building, it's best if you can limit the number of ways that they can get into the building.
So they should park in the parking garage and come in the
Yes.
Hannah entrance?
Yes.
That's the best way?
As it is right now, and again, keep in mind, we're still no visitation.
Right.
But that could be changing sometime in the near future. There's discussion of that as early as potentially August to open limited visitation back up again to some degree. But right now, as we tape this, no visitation. But yes, if we go back to a limited type of visitation, all of that traffic will come through the Hannah Outpatient Center. There will be limited hours when we do this, of course, and probably restricted to a single individual per person, per patient for the duration of their stay.
Right.
We do. I mean, COVID is still there. We're still living with this thing. So we're at a position now where we can relax it a little bit, but we still have to be very vigilant in protecting everybody, including staff and patients who are in the house and those coming into our building as well.
Right. And security has always been an issue there. It's been a concern. And because the hospital grounds are a thoroughfare. So if I'm downtown and I'm going to ride my bike or walk out to SU or whatever, I go right through the hospital. Right. And it's very convenient for me. But in reality, in terms of security, that's probably not the best situation to have.
Sure. We are, and it's hard to believe, but we're nearly 1 million square feet of property where the medical center sits today downtown. We have restricted, we put some gating up on some of the parking garages. You'll see over the next, let's say 3 to 5 years, I think, some berming, some fencing. Think Salisbury University and the black metal fencing that goes around. We'll be doing similar things around the perimeter. Very
subtle, it looks nice, it's not too invasive.
Around the perimeter of the campus. And the concept and the idea is to limit that transient traffic that goes through the medical center, as you say, as a point to just, it's a diagonal shot right straight across, and because of where we are, that's what we are. But it's best if we can limit the amount of people on the campus who don't need to be there. And again, this is all part of that big master security hardening plan that was in place before COVID and has really been accelerated because of it.
Even in COVID, you still managed to graduate a class of nurses.
We did. Pretty cool stuff, right? First time, I believe, in my 22 years of the organization that we've done anything like that. It was very, I'm sure you've seen the pictures, but it was very cool because they couldn't graduate, they couldn't cross a stage to receive their diplomas. So what we did for them was we created the next best thing in the auditorium of our ed center. We put them in shields, and we put them in hospital protective gowns. We attached the tassels to the shields on their face guards. So it was a traditional ceremony, and they moved the tassel from one side of their face shield to the other upon graduation, and they walked up and they received their diploma, and it was just something nice that we could do, a little bit of normal in an unnormal world, and it was just really remarkable.
Yeah.
It was wonderful.
Well, I know at Warwick they had to cancel their program because they couldn't get in there and do a lot of the stuff.
Yeah.
So they weren't able to get the training that they needed. And that's got to be an awkward situation because we need every healthcare provider that we can get.
Right. And I think what I really believe too is that because of what we're going through now, you'll see more people interested in the profession. And I do expect that, the techs and the nursing numbers will all increase at Warwick and Salisbury University. I think people will step up and really look at this as a profession that they want to be in for a number of years because, look, healthcare providers, first responders, healthcare heroes, they have been the backbone of the success of fighting back this virus.
So there's a rumor going around that you guys have a branding campaign going on. You might be changing the name of the hospital?
We do. So what I can tell you officially...
Now, when Steve Leonard was here in the winter, he would not even go there with me on this.
And I am not going to tell you anything more than the CEO has told you.
I thought, we're buddies. You can give me the news tip, but he would not go there.
I understand. I will float you a bogus name if you'd like that, and you can go with that and report that, but you'll eventually have to retract that.
I understand.
So, yes, the health system, Peninsula Regional Health System.
Right. Explain, this is needed because you guys have acquired a lot of other properties and you need some sort of an umbrella so that people can know what it is.
That's correct.
Yeah.
The health system has always been out there. It's been around for about 20 years. We haven't publicized it much because really the main entity and the only entity under the health system was Peninsula Regional Medical Center.
Right.
Now that we have Nanticoke Memorial Hospital in Seaford as part of our healthcare team, and the McCready Health Pavilion in Crisfield as part of our healthcare team, we've really become a true healthcare system. So,
and you have these other offices too: the breast care, the breast surgery center.
Correct.
The heart people have merged. I mean, there's lots of different offices around that are under you.
correct. Delmarva Heart, Peninsula Cardiology have all come on board.
Right.
So yes, so we're growing by leaps and bounds,
Right.
as they say. So we want a new name for the health system, one that reflects who we are and what we're doing. We've always wanted to take Peninsula Regional out of the name because it's so much more than just the medical center now. So September 1, we will be announcing the new name of the health system, and we'll be unveiling that and the new logo, and everyone will then have an opportunity to find out who we become, hopefully for many decades to come. I hope we never change the name again in the duration of my time at the medical center, because this has been a monumental task
Now
to get this done.
You're prepared for the fact that everyone's going to hate it. They'll keep calling it by the old name for another 2 decades.
Look, I am so used to being called PGH.
Yes,
Still today,
Still.
and I'm fine with that.
My family still calls it PGH. Yes.
I think, though, that when you hear the name, you'll love it. It'll be very reflective of who we are and what we do. And I believe that you will continue to embrace it. Now,
so it'll be called the hospital Greg Bassett was born in.
it is Bassett Healthcare.
I'm not the healthiest person. They gave me this, what is this thing called? Fitbit.
Fitbit. Mm-hmm.
And it's wired in and stuff, and I put it on the first time, and it dialed 911. So that's how healthy I am, but go ahead.
I'm surprised it even picked up a pulse on you, to be honest with you. But no. So the hospital names. Okay, so Peninsula Regional has been around for a long time. I mean, in Peninsula General Hospital before that. So
That's where I was born.
right. So the names are not going away, but there will be a new name that brands everybody together. But Peninsula Regional still retains its name for that component of the new health system. Nanticoke retains its name for that component of the health system, and the same with McCready down in Crisfield. But overarching will be this new name for the new system. So it will be, Bassett Healthcare Peninsula Regional.
Right.
Bassett Healthcare Nanticoke.
Gotcha. How's morale over there?
Wonderful. Wonderful. I mean, as you might expect, it's been a trying 3 or 4 months to get through all of this. People have been working extremely hard through all of this, but I think they're also taking great pride in what they've been able to do. Everyone that I have spoken with is pleased that they had the opportunity to be a part of this, because they've contributed and they've actually seen great results on what we've been able to do. And compared to other hospitals around the country, our death rate is remarkably low. And that's because of some of the innovative ways that we've chosen to treat patients and the care that we've put into making sure that we were prepared early to take this thing head on.
Yeah, doctor told me that every patient, they learn something new from every patient. They're able to apply it to the next patient.
I believe that's absolutely right.
You have this podcast that you do, that you record. It's really cool. It's way better than this show, for sure. Tell me about that.
It is not better than
Oh,
this
it
show.
is. No, it's good.
The host stinks.
No, you're actually prepared. It's good.
I enjoy doing it. It takes me back to my TV days. You can take the boy out of the newsroom, but you can really never take the newsroom out of the boy. It's why you do this, I'm sure. It's why I continue to do it. I love doing it. I love people. I love interviewing people. I love telling stories. I love hearing stories.
You're really good at it.
Well, thank you. I mean, you do a fine job here yourself, as we're part of this mutual admiration society. But no, it's an opportunity, again, just to get another version of our message out there and another way to communicate to people. And the beauty of it is, we record it as a podcast, but we tape it with the cameras as well.
Now, where can people see this? I want people to see this because it's really good.
Right. There is a video hub on our website at peninsula.org. If you go there, you can pick up all of the podcasts that we have done. And again, great information out there. And I try to get a good cross-section of people from the hospital to come in and speak to a number of different things.
Yeah.
Obviously, the last few months, it's been really COVID driven.
Right.
But we like to get everybody on there that we can get on there. And I mean, there are things that you'll find out. You know, maybe you want to know what it's like to run the kitchen at the hospital and how many meals have to be prepared to feed patients. Things like that. What's it like to work in environmental services? So it's not all doctors and nurses. It's really an opportunity for really a cross section of folks in the organization to come on and talk about what they do.
Right. You had Dr. Chris Snyder on there, who was your COVID doctor, leading that effort. And
Right.
his interview was so good. I learned so much from that.
Chris is, and this is what I like about Chris, for 20 years, and I've known Chris for 20 years. Chris for 20 years has been my wash your hands guy. That's been his message. He's been preaching it. So this has really been his opportunity to get out there and say, this is why I've been telling you to wash your hands and to continue to do it. But yeah, Chris is, when it comes to helping lead the charge against COVID in the hospital, he has been incredible.
On a personal level,
Yeah.
things must be tough for you because I know you love the Washington Nationals.
Yeah.
You were an usher at the Shorebirds.
Yeah.
So you don't have those elements in your life this summer. How is Roger Follebout coping?
He's playing a lot of golf.
Not that much, just one day a week that I see. Yeah.
Yeah. Well, I get out 2 times a week. I
Okay.
play in the golf league as well on Tuesday nights, but the hospital golf league on Tuesday nights. But yeah, I mean, I really miss my baseball. That was just probably the hardest shot to the gut.
Yeah, I mean, you
all
win the
year
World
long.
Series and then
Yeah.
nothing. Yeah.
Right. And now, with the 60-game season coming up, if the Nationals happen to win the World Series again, it'll have an asterisk
Right.
next to it, and it will never mean what it meant last year to do that. Locally, I miss the Shorebirds. I miss the people. I miss ushering out there at that ballpark. Looking forward to getting back to baseball again in 2021. I was really hopeful that we would do it this year, but then when Major League Baseball announced that it was holding its own 60-game season, you really knew it was kind of the end for minor league baseball, that they were just not going to put as much effort into running the minor leagues again and focus much of their attention on the majors and get through that 60-game season. So, yeah, I'm excited. I'm optimistic that baseball returns next year. The Shorebirds had a lot of great things planned this year, but we'll carry them over, and we'll do it again in 2021, or we'll do it for the first time in 2021.
He's Roger Follebout. He's our friend. We look forward to having him every year, and it's been a tough spring and winter for Roger, summer, but he's hanging in there, and we're just glad that he had time to be with us today. Thanks for all you do, Roger. Thank you so much.
Pleasure. Thanks for having me.
I'm Greg Bassett from the Salisbury Independent Newspaper. Another edition of 101 right here on PAC 14.
First Shore Federal is proud to support PAC 14 and one-on-one. We'd encourage every business to support PAC 14 and pick a program and support it, and let's make a difference.